There's something deeply unsettling happening at a Massachusetts hospital, and while officials insist everything is fine, the facts are hard to ignore. At Newton Wellesley Hospital, just outside Boston, 5 nurses who all worked on the same floor, the fifth-floor maternity unit, have been diagnosed with brain tumors. Yes, they're benign. That's what the hospital says. And they're different types, not a single, uniform pattern. But let's not be too quick to dismiss this. These are 5 individuals, all in the same workplace, in the same environment, developing tumors in the same organ. In total, 11 staff members reported health issues. The odds of this happening randomly are hard to calculate, but common sense alone suggests this isn't something we should brush off. The hospital conducted an internal investigation. They looked at the water supply, the air filtration systems, radiation exposure, even the use of disposable masks. And they say they found nothing. No link. No environmental trigger. No cause for concern. But here's the problem. The investigation was not independent. It was run by the same institution under scrutiny. The hospital insists that everything is safe, yet the Massachusetts Nurses Association, the union representing these staff, isn't convinced. They've launched their own investigation because they believe the hospital's testing was not only incomplete, but selectively narrow. And they're right to be skeptical, because when 5 nurses who share the same workplace develop tumors, it's not just about statistics. It's about responsibility. According to the union, the hospital only interviewed a limited number of nurses and failed to conduct a thorough environmental assessment. What's more, the conclusions it reached seem aimed more at reassurance than real discovery. And that raises an important question. Are we prioritizing patient and staff safety, or the hospital's reputation? There's a tendency in public health crises to focus on the data, to say things like, well, these tumors were benign, or they were different types, or there's no clear pattern. But what about the people? These are nurses, caregivers. They've spent years putting their own health on the line for others. And now, when something is clearly wrong, they're told it's probably a coincidence. The American Cancer Society points out that for a cancer cluster to be officially recognized, cases must be of the same type, in the same area, with the same cause, and in higher numbers than expected. But they also acknowledge that nearly 40% of Americans will be diagnosed with cancer at some point in their lives, so it's not rare. And that ambiguity, that statistical gray area, is often where real danger hides. It's important to say this clearly. Just because the tumors aren't malignant doesn't mean they aren't serious. Brain tumors, even benign ones, can be life-altering. They can cause neurological symptoms, require invasive surgery, and leave lasting physical and emotional impacts. For 5 nurses to go through that on the same floor in the same hospital should not be minimized. Right now, federal and state occupational health agencies haven't provided answers. That silence is deafening. In the absence of clarity, speculation fills the void, and that's dangerous too. But what's even more dangerous is pretending there's no problem at all. This isn't just about 5 nurses. It's about a system that too often prioritizes damage control over truth. It's about transparency and whether we believe health workers when they say something feels wrong. It's about whether institutions are truly willing to protect their staff or just protect their image. If this turns out to be a coincidence, the best-case scenario is that we learn something about how to investigate these situations better. But if it's not, if there is a hidden environmental factor or an overlooked risk, every day without action is another day of potential harm. In healthcare, there's a rule we often repeat. First, do no harm. But silence, delay, and dismissal are forms of harm. The nurses at Newton Wellesley deserve answers. And so do the rest of us. Because if it can happen quietly in one hospital, it can happen anywhere.